So for this presentation, I am going over the soccer kick in the kinesiology study by Allison Stockman. The introduction that I'll be going through is the phases, the ACL, the injury management, injury assessment, treatment, and feedback. The phases of the kick will be the approach, the planting, the initial contact, the follow-through, and the landing. For the approach, another word for it's going to be called the running up phase. You create a lot of power and velocity with doing this. This is going to be basically where you run up towards the ball, and the longer strides that you do can create more momentum in the actual soccer kick. For the planting phase, so if you are going to be right foot dominant, you would plant your left foot on the outside of the ball, which is then flexing that knee. While the dominant side is going to be hyperextending while going through that phase. While the arms, as you can tell in this picture, is raised up in the air, this is plays a role in balancing yourself while kicking the soccer ball. The initial contact is where you then make the first contact of the ball, which you dorsiflect the dorsiflexion of the ankle while the right foot / dominant leg, the knee is flexed while contacting the soccer ball, while the non-dominant foot, the left leg, will slowly extend, thus creating higher forces. So while you are kicking, your leg will then extend slowly while your right leg is flexing into the extension. In this photo right here, you can see the kid has followed all the way through. The ball is in the air. This will then begin for the left leg to leave the ground and flexing the hip, the knee, and the foot of that left leg. For the landing, this is where a hop motion occurs. So it looks like you're taking a little hop, and that left leg is then planted on the ground, and the right leg is in the air. If some athletes like to follow through onto the right foot to create better stabilization. It's up to you and your skill level, but this then will cause flexion of the right leg, the right knee, to continue to absorb impact. So once it follows through onto that right leg, it will kind of flex, which will then not result in higher amounts of energy or injury. The joints and the muscles we'll use will be the acetobulofemoral, the tibiofemoral, and the talocrucial. The first one is going to be for your hip, where the tibiofemoral is going to be your knee, and the talocrucial is going to be your ankle. And the muscles that's going to be used throughout each phase will be the quadriceps, the gluteus maximus and medius, tensor fascia latae, hamstring muscles, adductor magnus, plantar flexors, hip flexors, and knee extensor muscles. Each muscle group will be categorized in each phase of the kick. For the movements during the prep phase, such as the running up and the planting, will be your hip extension and hyperextension, knee flexion, and ankle plantar flexion, while kicking and kind of with the follow through will be the hip flexion, knee extension, and ankle plantar flexion. For the anterior cruciate ligament ACL, this is going to be where it involves the underside of the femur, where it wraps around to the tibia. This prevents the tibia from sliding in and out of the femur, and then provides knee stability. The reason why I chose to do the ACL injury during the soccer kick is because that is one of the highest rates of injury in soccer, and this usually occurs when the foot is planted and the body pivots into a very high excursion. With the large amounts of pressure, this can create a tendency for the athletes to plant their knee and keep it stabilized. So while the knee is stabilized and you want to turn left or right, and that knee is still stabilized, that's where high amounts of injury of the ACL will occur. The reason why females tear this ligament more is because men rely on using the hip abductor muscles and build strength, while females then use your quadriceps and hamstrings and more lower half muscles, which then causes a weakness in the abductor muscles, which then not support the ligament as much as what the males would occur. As you can tell in this picture, the left leg of this gentleman, the knee has swelled up, and that is because the blood is flowed into that area. A lot of people think it's just fluid and water, but it's actually straight up blood, and they can tell this through an MRI. The pain will not be immediate, but over time it will create more of a nuisance. And while the knee will lose stability, a lot of the athletes will feel a weakness where they can't put any pressure, or it's not able to even hold the leg up. For the treatment, you have surgery that reconstruct, so you use a little bit part of your hamstring ligament to create a reconstruction, and that will take about 3 minutes for the tissue and the ligament to actually heal and kind of replace itself and acts of an ACL. The healing total without like the swelling and so forth will take about 6 months, but it will take a full year of physical therapy and slow progression into normal play to be able to be at your 100% at your performance. A lot of coaches and athletic trainers, really focus on the doctor's notes. If they don't follow the doctor's notes, you're going to cause more injury to the athlete, which is not what you need to do. For the feedback on the milestones, I think going through this kind of opens my eye up to when I assess my athletes when it comes to the soccer kicks. I was really more intrigued into the injury assessment, especially knowing how your body moves while you're doing a soccer kick and how the ligament can play through the motions of it. One interesting thing I did find out about all this stuff is the amount of muscles used to do a soccer kick. I honestly thought that you would just use your hamstrings and your quads and your glutes, but I didn't know that you would use your abductor muscles and your knee flexors as well, which is very interesting to me. For the citations I have are right here. Feel free to look at them as well. Thank you so much. This was my presentation of my milestones. Thank you.